Hi guys, welcome back to my video. My name is Nafia Mulyawati. This time I want to answer question of case study one about privacy, and I will reading case study one. Dr. D was an obstetric or gynecology resident pursuing a joint residence at the State University Medical Center and the regional hospital. During an invasive surgical procedure, Dr. D was accidentally cut by the attending physician. The record does not indicate whether there was any actual blood contact between Dr. D and the patient. It appeared there was no blood exposure, although no one can be certain. The following day, Dr. D voluntarily submitted to blood testing for the HIV virus. The result confirmed that Dr. D was HIV positive. After being informed of the test result, Dr. D willingly withdrew from participating in further surgical procedures, informed the appropriate official of this condition, and requested a voluntary leave of absence. Upon investigation, the medical center identified 207 non-patients who had been involved to some degree with Dr. D during of course of their medical treatment. Likewise, the hospital identified 168 patients who had been in contact with Dr. D since the time of the joint residence. Unfortunately, hospital records do not necessarily indicate X time a physician is card, nor do they specify the distinct role of each physician in a surgical procedure. Thus, every patient with a reasonable chance of exposure to Dr. D was included in the statistic outlined above. But the medical center and the hospital filed petition urging a compelling need to disclose information regarding Dr. D condition to those patients potentially affected by contact with him. In addition, the hospital believed there was a compelling need to disclose Dr. D's name to the other treating physician in the department, so that those physicians could contact their patient in the event they had been assisted by Dr. D in any invasive procedure. In response, Dr. D asserted his right to privacy, arguing that no compelling need was tantamount to the justification to disclose his HIV-related information. And question is, Should the hospital disclose Dr. D disease? And my opinion is no, because every hospital has an obligation to ensure the health of its medical personnel. Therefore, the hospital is responsible for notifying the disease and the impact of the disease that will cause in the environment of people in the hospital. But disclosure of the disease shall only be disclosed to the person concerned or the family concerned. Health problems are private matters that are confidential. All action to the taken by doctor to patient must also be with the patient's consent, because the patient has the right to agree or disagree. If the hospital continues to disclose HIV/AIDS, which is barred by Dr. D, the hospital violated human right to maintain a confidential diagnosis of the patient, and hospital failed to the two code of ethics as a form of health care for their patient. And a patient preference should not be disseminated, because if the doctor is disseminated HIV positive, this will have an impact on another, so that it makes doctor, nurse, and other medical personnel reluctant to treat the doctor who is infected with HIV. This is my consider. Thank you.